This is Dr. Caroline Peterson talking to you today about swelling of the left leg. May-Thurner syndrome is one of the reasons that people could have swelling of the left leg. A lot of times they'll see their doctor and their doctor will be like, oh, you're just fat. You have a fat left leg. If they do a ultrasound and they don't find any clots in the veins, then they'll say, well, we don't know, just try to lose some weight, or maybe there's an incidental finding of bony growth somewhere else unrelated, and they think that maybe that's the cause. Or maybe they go to the foot doctor and the foot doctor says, well, yes, you have swelling in your leg and we don't know why. And a lot of times this could be because it's actually coming from higher up. So May-Thurner syndrome is something that's actually pretty darn common, but it's not talked about very much. And the symptoms can be anywhere from just a mild swelling of the left side of left leg, not the right one, all the way up to blood clots. It can also cause ulcerations in the kind of by the ankle because you're not getting good venous return. And so there's a gradient of impact. Some people will just experience some swelling at the end of the day where they notice, man, my shoe on the left side is a little bit tight. That's kind of weird. And maybe my leg is a little shiny. Maybe it's a little bit warm because the blood's not getting out of there. So there can be a whole range of symptoms. Like everything, everything's a progression. So things don't start off as cancer. They start off as things that are more mild. Sometimes they develop, sometimes they don't. And so a person can present at any point along the way. So it's interesting because this is actually happening far up. You can see at the lumbosacral juncture where we have the vena cava, the abdominal vena cava, and the abdominal aorta branch off right there into the common iliac veins here, and then the common iliac arteries. So how'd that happen? So you can see that the left common iliac vein is underneath of the right common iliac artery. And so if there's compression of the right common iliac artery onto the left iliac vein, then this is going to be an irritant to the vein, and the vein will respond by creating more tissue to push against the pulsations of the right common iliac artery. This is the way the body is. If you push something, something will push back. So this is the compression, chronic compression, that then can create kind of like a spur. They call it a spur. It's not a bony spur, but it's a soft tissue type of growth that then impairs the venous return because it encroaches, and so there's not as much room. So it's on this left side here, this common iliac vein goes into the internal and the external iliac vein. The external iliac vein is what pulls up everything from the lower extremity, and so the internal iliac vein is what pulls up blood from the pelvis. So if there's encroachment here, then you're going to have difficulties both probably with the lower extremity on the left and the pelvic drainage on the left, although there may be some forgiveness, especially for the pelvis. So these are the stages of May-Thurner syndrome. Asymptomatic at first, you don't hardly notice it, or maybe just at the end of the day, the tight shoe, like I was saying. And then you get that over time, you're getting decreased size of the lumen or the inside part of the vein, because it's pushing back against the irritant of the pulsations of the artery. And then eventually the venous return will slow to such a degree that you'll get a thrombosis in the deep veins in the calf typically, and that's a blood clot. And so that's what they're looking for, and that's usually when biomedicine feels like it can intervene. Of course, we want to intervene earlier in natural medicine. We want to intervene before you get the big leg. When we're just seeing mild differences, maybe just differences at the end of the day, then we're happy to intervene that soon. We don't have to wait for a blood clot in order to intervene. So the risk factors are being female, having a scoliosis. You can see that the scoliosis is a lateral curvature of the spine, and that can, depending on where it is, that can cause, you know, tension or irritation, or the fascia and the retroperitoneal covering to be tight. Pregnancy postpartum will push back onto the aorta. Postpartum can be either problems because they were pregnant or because of the birth itself, where there was more pressure, exertion, moving things around. Immobilization, of course, that sets people up for clots. And then surgery is similar. People are set up for clots with that. So in cadaveric studies, there was a very common finding of this compression of the left common iliac vein. Of course, with ranges like this, it's very kind of meaningless because they're too big. And so it's saying that these studies are not very good. So when you have a good study, then you're going to see a smaller range. So these studies, basically it's saying it's not a big enough study is what it's saying, or it's not a comprehensive enough study to really get very good numbers. But surely it's not uncommon. So in biomedicine, the differential diagnoses, the other things that can be happening in addition to this May-Thurner syndrome are some kind of growth, like malignancy or lymphadenopathy, which is congestion of the lymphatic system. A hematoma is like a big collection of blood from an injury, typically a lot of trauma in the abdomen. Cellulitis would also be like tissue that's inflamed, but probably from infection. And then we talked before about uterine enlargement. This can be pregnancy, it could be fibroids, it could be other types of pelvic masses. Anything that would press back against that posterior wall of the pelvis and lower back. And then the retroperitoneal fibrosis. So that's when the fascia is suctioned on too tight around the aorta and the vena cava, and then the branches that come off of them. So these things are things, you know, that we can deal with visceral and vascular manipulation. If we're talking about any kind of fibrosis of the fascia, fascial limitations, if we're talking about any kind of pelvic congestion, if we're talking about, you know, uterine masses, those are things that have the possibility of being able to be dealt with to some degree with visceral manipulation. So typically the workup for this is going to be a venography with intravascular ultrasound. And so the reason that this is like such an awesome way to work up is because you don't need contrast. And so contrast is hard for your body to detox from. And so that's good. You don't have to have that. And then it's just very specific because the biomedical intervention is to put a stent in. And so they would need to have the imaging in order to know exactly where to put the stent. And so this is this is terrific for that. So conservative management, it would be what I do, right? I manage things conservatively. And so that's visceral manipulation. And so that's checking to make sure that the organs and the structures that are around the iliac veins and arteries are moving properly, checking to make sure that the fascia is not adhesed in this area, checking to make sure we're not having too much collection and accumulation of lymphatic fluid that also can compress down on the vascular structures. One of the things that I always do is train people in proper movement and proper breathing, proper activation of muscles and proper activation of the whole physiologic breathing mechanism, because that helps to make sure that we get proper drainage and that the organs and flow of the body is set up properly. Of course, if we do a trial of therapy and we don't get the improvement that we need, then of course the surgical intervention would be indicated. The surgical intervention, as I mentioned before, is the stent to keep that left common iliac vein open and to prevent clots, deep vein thrombosis of the left calf, because that can be very dangerous. And of course, we don't want that to happen. So many times, because there's a risk of clot formation, anytime you get slowing of the venous system, congestion, that type of leg swelling, then I'll put people on some herbs and some enzymes to help support the venous system and to help break down clots, like a nattokinase or a lumbrokinase, and to make the blood slippery, like fish oil, so that we just keep things moving as we're rehabilitating that venous system. Thanks.